Okay, so a pleasant morning, a pleasant afternoon, a pleasant evening to everybody. So this is part of our um, cholesterol measurement discussion for today. So good morning to everybody, good afternoon, or good evening, whatever time you're watching this. So greetings to the to all sections 1 MTO1, 1 MTO2, 1 MTO3, and of course 1 MTO4. Good day to everybody. So for this morning, for this day, we'll be discussing about your cholesterol measurement. So before take, hopefully by this time you already are finished taking the pre-test of this particular discussion. So we'll go straight and discuss everything that you need to know when it comes to cholesterol measurement. So let's dig in and let's get started with our discussion for today. So let's move to our next slide. So for this morning, for this day rather, the objectives of our um, virtual experiment online experiment is first to discuss the pre-analytical variables affecting the measurement of cholesterol. So hopefully by this time as well, you're also finished with the different pre-analytical factors or parameters that are affecting our different analytes in clinical chemistry, which is discussed in your clinical chemistry 1 lecture. So if you haven't done that, hopefully later, okay, you'll go straight and also watch and study the video, also your books and your notes for that particular topic. So aside from that, so our goal is also for us to be able to discuss the principle of your glucose of your cholesterol oxidase method, which is the enzymatic method used to measure quantitatively the to measure the levels or the amount or the concentration of cholesterol inside our body. Next is for you to be able to know how to properly perform the measurement of cholesterol through spectrophotometry, elaborate as well the different clinical significance of cholesterol measurement to various dyslipidemia, and finally to calculate the concentration of your serum or plasma cholesterol in conventional and also in SI unit. So before we get started, let us all discuss and define what are cholesterol. Bakit ba important sila? Why are they important? And what is their significance when it comes to our body? And what is their association when it comes to the different diseases? So if you're with me, please turn into your book. You can see this at exercise number 6, which is cholesterol measurement. Now, moving forward, cholesterol is actually an as is an example of an unsaturated sterile alcohol which are present in all cells. Why do we say that it is present in all cells? Because cholesterol, did you know, that is an integral component of your cell membrane. So remember that your membrane or your cell membrane is a lipid bilayer. And that lipid that we're talking about there is actually cholesterol. More specifically, these are free cholesterol. Free cholesterol because they are amphipathic, meaning to say amphipathic, they have their hydrophilic side and hydrophobic side. Okay, hydrophilic and hydrophobic side, which also enable our cells to have a semi-permeable selection, okay, our cell membrane to become semi-permeable on the things that it will allow to enter and things that it will not allow to enter the cell. Okay? So please take note that cholesterol, unlike your triglyceride, unlike your glucose, your carbohydrate, cholesterol does not serve as an energy source in your cells or for your cells. Why? Because cholesterol cannot become a fuel for glycolysis. It cannot also be converted to your it cannot be converted to your um, glucose as well. So your cholesterol is not a source of energy. Okay, it's not a source of energy. If it's not a source of energy, what is its purpose? Well, aside from being an integral part of your cell membrane, your cholesterol also is a precursor for your steroid hormones. So when we say steroid hormone, these are fat-soluble hormones such as your cholesterol, your cortisol, your estrogen, testosterone, and your progesterone. And aside from that, it also is for your bile salt. Okay, it is also a precursor of your bile salt. So remember that your cholesterol are precursor for most of your sex hormones like estrogen, testosterone, and progesterone, and also a precursor for your steroid hormone like your cortisol, to name a few. And of course, precursor din siya for your bile salt. Okay? Precursor din siya for your bile salt. So, even though your cholesterol is not serving as an energy source for your body because your cells cannot catabolize them, your cholesterol, on the other hand, are precursor for valuable hormones in the sexual development of a person and also in the emulsification of fats through the help of your bile salt. Okay, through the help of your bile salt. So yung bile salt natin, it is being secreted in your gastrointestinal tract so that the emulsification of fats from our diet would be made possible. So just like what I was mentioning a while back, your cholesterol, being an unsaturated steroid alcohol, has two forms inside our body. So in your serum, you can actually see two forms of cholesterol, your free cholesterol and your cholesterol esters. Okay, so what are the difference between the two? Your free cholesterols are amphipathic. Okay, when we say amphipathic, they have their hydrophilic, ibig sabihin water-loving side, and they do have their hydrophobic side. So if you guys could remember the lipid bilayer, the head is the hydrophilic side, and the tails are the hydrophobic side of the cholesterol. So those are actually free cholesterol. So your free cholesterols, aside from having an amphipathic side, a hydrophilic and a hydrophobic side, it is also found in your phospholipids, okay, in your phospholipid, in the lipid bilayer of your cells, okay, in the lipid bilayer of your cells. Although, okay, it's very much important for you guys to remember that the one on your lipid bilayer are mostly phospholipids. Okay, they are mostly phospholipids. Okay, phospholipids. So, in addition to that, we also have your cholesterol esters. Okay, your cholesterol esters, which are very hydrophobic. Okay, when we say very hydrophobic, they cannot mix, they cannot be mixed with your water. Hence, they cannot also travel in your plasma or in your plasma within the body. Why, sir? Because your plasma, remember, is almost a majority of your plasma, 90% of your plasma is actually made up of water. So your cholesterol ester cannot travel in our bloodstreams alone. Thus, it needs your carrier molecule in the form of your low density lipoprotein, your LDL, okay, your LDLC or simply LDL, which are also known to be your bad cholesterol. Your LDL um, is the one that transports your cholesterol from the liver going to your peripheral tissues. Okay? Going to your peripheral tissues. Sir, bakit ba kasi kailangan, why do we need to transport your cholesterol coming from the liver going to the peripheral tissue? Remember, your cholesterol is important, okay, in the formation of your cell membrane. So cells will be needing your cholesterol in that sense. Okay? So please do remember again that your cholesterol have two forms, your free cholesterol and your cholesterol ester. Your free cholesterol can freely flow on your bloodstream because it is amphipathic. Your cholesterol esters, on the other hand, cannot be transported freely on your bloodstream. That's why they need a carrier molecule in the form of your low density lipoprotein or your LDLC that will transport your cholesterol ester from the liver going into your peripheral tissues. Okay, going to your peripheral tissue. And just like what I was mentioning a while back, your cholesterol, okay, one of our objective is to associate your cholesterol into disease into your diseases. Did you know that your cholesterol, okay, your cholesterols, more specifically, the cholesterol being carried by your low density lipoprotein are direct, okay, they are direct risk predictor of cardiovascular diseases. Okay, so your cardiovascular diseases risk and the extent of your atherosclerotic process are strongly associated with your serum cholesterol, particularly in your LDLC. I need to explain this very quickly because we're not yet on the lipids and lipoprotein as this particular experiment is being discussed, your LDL-C, okay, your cholesterol are being carried by two carrier molecule, two lipoprotein, your low density lipoprotein and your high density lipoprotein. Let's try to um differentiate them very quickly. Your low density lipoprotein carries your cholesterol coming from the liver going to your peripheral tissue, meaning to say your LDL or your low density lipoprotein carries the cholesterol from the liver to the cells that will be using them. Okay? That will be using them. On the other hand, you also have your high density lipoprotein, which is your HDL, also known as your good cholesterol. Why good cholesterol? Because your HDL, anything in excess, okay? Anything in excess in your peripheral tissue, it will collect. Okay? All the excess cholesterol in your peripheral tissue, your HDL will collect and will return it back to your liver. Okay? So that it will be metabolized and will be utilized as precursors for your steroid hormones, for your sex hormones, and also your bile salts. Okay? That's the scenario. But when it comes to cardiovascular diseases and atherosclerosis, what happened is there's too much cholesterol built up on your peripheral tissue, and ironically, as your LDL increases, your HDL decreases. So they are inversely proportional. Okay? They are inversely proportional. So in Tagalog, dahil wala ng HDL that will collect the excess LDL, cholesterol mo ngayon ay tataas. In English, for our international students, your since your HDL cholesterol will decrease, okay, in concentration, there will be not enough HDL to collect the excess cholesterol in your peripheral tissue. So, cholesterol now will start to build up on your blood streams, okay? It will start to build up now on your it will now start to build up on your um it will now start to build up on your it will now start to build up on your blood vessels. So we'll be discussing more about the disease progression of your cardiovascular disease and atherosclerosis when we go to your lipid, because there's a specific lecture for that, so that I'll be able to explain to you guys the process on how your cholesterol are deposited on your blood vessels and form a plaque that will now hinder, or that will now block your coronary arteries. Okay? So, in a nutshell, the intended use of your cholesterol measurement is more particular when it comes to the prediction or in the assessment and even in the monitoring of cardiovascular diseases and even atherosclerosis in your patient. So remember that when your LDL increases, the risk of cardiovascular disease and your atherosclerosis also increases. So higher cholesterol will predispose you to what? Higher cholesterol will predispose you to cardiovascular diseases and even atherosclerosis. Okay, so please remember that. So now, in the laboratory, it's very important for us to be able to measure them properly. So similarly, when it comes to the pre-analytical, it's the patient preparation is also important. But did you know that your cholesterol is actually part of a panel? When we say panel, these are group of tests being done in the laboratory. And the panel actually includes your cholesterol, your triglyceride, your HDL, your LDL, and also your VLDL. So all of those are lipoproteins that carry your lipids, that carry your cholesterol and your triglyceride, together with the measurement of your triglyceride, and also your cholesterol. So they are a group of tests. Okay, they are a group of tests. But by this time, if you already are finished with our lecture in patient preparation, you have an idea now that cholesterol, okay, rather in the lipid profile, the only one that requires fasting is your triglyceride. Triglyceride requires a 10 to 12 hours or a 10 to 14-hour fasting before blood collection. Okay? But, okay, your cholesterol actually do not require it. Your cholesterol, this is the I have to clarify this because for most of the people and even in the laboratory, they actually mistaken cholesterol to be a fasting exam or a fasting analyte. But in reality, it is not. The reason why a lot of people thought that cholesterol also requires fasting is because most of the time cholesterol and triglyceride are being measured together. Kasi nga, because it is a lipid profile. You have your chole, you have your triglyceride together with your HDL, LDL, and VLDL. Okay, that's the problem. But if we're going to be more technical, if we're going to look into your cholesterol do not require fasting. It is only your triglyceride that require your fasting. Again, let me repeat that. It is only your it is only your triglyceride that requires fasting. Again, it is only your triglyceride that requires your fasting for 10 to 14 hours. Why? Because it would take 10 to 14 hours for your exogenous triglyceride to be cleared out of your bloodstream. Ang cholesterol kasi is not majority of your cholesterol are not from your diet but rather from your liver. Okay? So meaning to say endogenous. Whatever you eat, okay, whatever you eat, it will not actually affect the cholesterol levels of your body because the cholesterol that are in your bloodstream are from your liver. Okay, produced from your liver. Okay, so having said that, let's go to your patient preparation. I just want to reiterate that there is no fasting required. Okay, there is no fasting required for your cholesterol. Second, patient should avoid smoking and strenuous exercises prior to collection. Why? Because smoking, your nicotine in particular, can affect your cholesterol. Strenuous exercises can affect your posture, thereby affecting the levels of your cholesterol. Remember that the National Cholesterol Education Program or NECP mentioned that the blood should be collected after the patient has been in a seated position or in a stable position, whether supine or seating, for at least 5 minutes before specimen collection. So please remember that when it comes to posture. If you have not remembered that or if you forgotten that, please make sure to review the pre-analytical, the patient preparation that was discussed in the lecture. Finally, for your patient preparation, please do also remember that tourniquet application should not be applied for longer than a minute or two because it will cause hemo concentration, which will lead to a falsely increased cholesterol level. And I also want to highlight here, remember that it's also very much important for you to take note, okay? To take note that your patient should be in a stable or in a position for at least 5 minutes before blood collection. Okay. As for the specimen collection, let's talk about specimen collection. The specimen of choice is your serum. Okay, serum. For most of the laboratory, we're still using serum. For most clinical chemistry section, we're using your serum. Although, if you're trying to read your inserts or your manuals, it actually can also use your plasma. Okay, so for your serum, you can use your gold top tube, your red glass, your red plastic, or your orange top tube. You can also use your plasma. Okay, you can also use your plasma in a form of your purple top. So if you in your pre-test a while back, so you can use your plasma as your specimen for cholesterol measurement. And when it comes to your serum tube, the most commonly used are your red top tubes or your gold top tubes in the laboratory. Remember that you cannot we even though we will be using your plasma, okay, we will be using your plasma, it is not advised to use your citrate or your light blue top and your gray top tube that contains your potassium oxalate and sodium fluoride. Okay, it's not advised. Okay, although you can also add on your notes, aside from your purple top tube, we can use your heparin as your anticoagulant or your green top tubes. Okay, your green top tubes. So that is for your specimen collection. Of course, as prescribed by CLSI, the most preferred manner of collection is through evacuated tube system, although you can also collect your blood samples through butterfly or wing infusion set in your syringe system. Now, as for the specimen collection, more specifically for the rejection criteria, please do remember that collection tube uh, rejection criteria are as follow. Collection tube use was wrong. So if you use a light blue top, a gray top, or a yellow top tube, that will be discarded, that will be rejected. Improperly labeled specimen will also be rejected. Always remember that patient identification is always a must and always important in the laboratory. Quantity not sufficient, meaning to say QNS, the quantity of the specimen collected is not enough. There is no requisition form, and hemolyzed samples are also rejected. Why hemolyzed sample? Hemolyzed sample. Remember that in your cells, okay, in your cells, the cell membrane is made up of free cholesterols. Okay, your free cholesterol. So if your cells are lyes, if your red blood cells are lyes, the free cholesterol um will be um will be mixing together with your serum or your plasma and will cause a falsely increased cholesterol levels. Okay, not to mention the hemolysis, the hemolyzed sample also affect the absorbance of your measurement. Okay, so those are the rejection criteria, specimen collection, and patient preparation. So I want you guys to remember how when it comes to patient preparation, there's no fasting. Remember the 5-minute rule when it comes to stabilizing the position of your patient. And of course, remember the specimen that is to be used, serum and plasma, including the collection tube. Please, again, include, aside from purple top tube, you can also use your green top or your light green top in the collection. Now, finally, for the measurement of your cholesterol, we are actually using your cholesterol oxidase method. Okay, your cholesterol oxidase method. So the principle of the test is that the cholesterol esters present in the serum are hydrolyzed by your cholesterol esterase. When we say cholesterol esters, these are the bonds, okay, the bonds seen in your cholesterol. So it is first hydrolyzed by your cholesterol esterase, liberating now your cholesterol. Specifically, cholesterol esters, ito yung mga bound. Okay? These are your bound cholesterols. Okay? Bound cholesterol from a carrier molecule or whatsoever. Okay? So, your cholesterol esters after that will now be oxidized by your cholesterol oxidase. Okay? And upon its oxidation, it will now your produce your hydrogen peroxide. If I may, I will now shift to the next slide. If you guys can see here on your screen, your cholesterol esters will be hydrolyzed by your cholesterol esterase, forming now your cholesterol and your fatty acids. Your cholesterol here will be acted upon by your cholesterol oxidase. Your cholesterol oxidase will act upon your cholesterol, oxidizing it, forming now your choles for cholestynin, okay, and also your hydrogen peroxide. So the hydrogen peroxide that is produced is directly proportional to the cholesterol, okay? So afterwards, the hydrogen peroxide, as you can see, no, the hydrogen peroxide will be the one used, okay? Your hydrogen peroxide will be acted upon, okay, will be acted upon, okay, by your phenol and your 4-amino antipyrine, okay? Antipyrine, okay? So upon the addition of your 4-amino antipyrine and your phenol, it will now act upon your hydrogen peroxide, forming now a quinoniamine, okay? Quinoniamine dye and water. Now the the quinonimine dye is a colored substance. Okay, this one will be measured now to your spectrophotometer. And remember, the color intensity of your quinonimine dye is directly proportional to the amount of your cholesterol. Again, the intensity of the color is directly proportional to the concentration of your cholesterol. So I just want you guys to remember no na here the hydrogen peroxide produced is also directly proportional to the cholesterol. So kung gaano kadami yung cholesterol, ganun din kadami yung na-produce na hydrogen peroxide in which hydrogen peroxide will be acted upon by your 4-amino antipyrine and your phenol forming now your quinonimine dye, which is a colored substance. Okay, this colored substance now will be measured through your spectrophotometer, in which we'll be able to measure the concentration of your cholesterol. So as for the procedures, okay, remember to label all your tubes. So you have your blank, you have your standard, your normal, and your abnormal control, and your patient sample. Remember that we will be needing 100 microliter of your cholesterol oxidase reagent. And then for your sample, okay, we'll be needing 10 microliter of your standard, 10 microliter of your normal control, 10 microliter of your abnormal control, and also 10 microliter of your patient sample. And remember, for your blank, you'll be mixing 1000 microliter of your reagent with 10 microliter of your distilled water. Okay, your distilled water. So this one, the blank here, this is actually your reagent blank. Okay, to be more specific, this is your reagent blank. Okay, reagent blank. So after labeling and after dispensing the desired volume to the different tubes, we'll mix them and incubate them for 10 minutes if it is a room temperature. If you're using a water bath or if you're using an incubator, you can incubate it at 37 degrees Celsius for 5 minutes. And after incubating for 5 minutes or 10 minutes, depending on the temperature that you use, the endpoint, okay, or the solution can be measured within 1 hour or 60 minutes because it's only stable for 60 minutes. So we need to measure the solution at an absorbance of 500 nanometer. Okay, 500 nanometer. So we need to measure the absorbance of the standard and the sample again, the reagent blank at 500 nanometer. Remember the wavelength that is being used, 500 nanometer. Now finally, after doing so, you can record the results and compute for the serum cholesterol concentration. The formula is as follow. So you just substitute the absorbance of your patient sample or the absorbance of your control if you're measuring for the absorbance of the concentration of your control all over the absorbance of your standard times 200 milligrams per deciliter. So as for the level or the reference ranges for your cholesterol, less than 200 milligrams per deciliter is the desirable amount of or the desirable concentration of your cholesterol inside your body. At 200 to 239 milligrams per deciliter, that's milligrams per deciliter, is already borderline high, and greater than 240 milligrams per deciliter is already high, considered to be high cholesterol. So for us to be able to measure or for us to be able to convert milligrams per deciliter for the information of everyone is the conventional unit. For us to be able to convert it to your SI unit, we need to multiply it by 0.025, okay, for us to be able to convert it to millimoles per liters. Okay, millimoles per liter. Again, for your SI, millimoles per liter. So if you multiply 0.026 to 200, this is around 5.10 millimoles per liter, which is actually the answer in your quiz, in your pretest. Okay? So with that, thank you so much for listening. Now for your data, I want you to take note of the following data. So these are the data set that you will be using for your measurement. So this is the absorbance of your standard, your control, your pathologic control or your abnormal control, and your patient sample. So please make sure to complete the tables on your laboratory manual, and please do not forget to answer the post laboratory questions because you will be submitting them by the end of the meeting. So with that, if you have any questions or clarification, please do send me a message, or if if I'm still present at this particular time during class, you can just simply raise your hand and ask me. Now, if you don't have any questions or clarification, please head over to your laboratory manual and finish your data and result together with your post laboratory questions. And that is it for our laboratory exercise number 6 about cholesterol measurement. Thank you so much for listening, and I will see you on our next laboratory. So please prepare. Okay, please prepare for your practical exam that will be covering your glucose, your cholesterol, and also your triglyceride. Again, please refer to the schedule that we sent you last week for your guidance. Again, thank you so much for listening, and I'll see you on our next discussion. Goodbye.